I'm gonna start the recording and turn off that transcript because I see why everybody hates that because it's annoying. Okay, there we go. Okay, so I've never done one of these. Amanda was the last one who did it, so I'm trying to remember how she did these. But first off, I want to thank you, Professor, for joining us and taking a moment out of your time to explain to us about what nursing education is and pretty much how, as students, what are we going to look for if we decide to go down this career path in the future.
Okay.
First, can you introduce yourself and kind of explain your background as a nurse and as a nurse educator?
Okay. Well, thank you for inviting me today for the I just want to start out by saying that. So my name is Jessica Winstead. I live in Northwest Tennessee. You can't find it on a map. People in my own county think that I live in another state. That's a true story. That's a long story, but anyone that's had me in DFC knows it. But Kentucky is right across the street from my house. I have been a nurse since 2008. I have been in education since 2012. No, 2011. Apologize, 2011. I started my nursing career at an ADN program. Actually, I started in a BSN program. I was a non-traditional student, 25 years old, and my one of my professors at the 4-year that I was going to, she recommended that when I applied to school that I needed to go ahead and apply to a couple others because you don't want to put all your eggs in a basket. And so I did take her advice and I applied to another 4-year and I applied to 2 other schools that were community colleges, 2-year colleges. We all know 2-year. If you've done that, it's really 3. But I had all my prerequisites done. And so I was actually accepted into all 4 schools. And so at that point, I looked at my options, and for me, it seemed like my best option was to go ahead and get my ADN and get out there and get working, because where I live, there's no difference in pay between a bachelor's and an associate's. So again, remember, I was 25, had a couple kids, and so I thought, you know what, this is what I'm going to do. And so I went ahead, finished up my ADN program, thought I'm never going to do school again. I'm going to go be a nurse. I love it. And 3 years into my nursing career, the opportunity came up for me to teach at the local high school. They were starting a health science program and they needed someone to start it. And I love the idea of being involved in a new process. I've been involved in many different projects before, and I love ground up work. I think it's great. So I jumped in head first, no clue what I was doing. And I really enjoyed it. I loved it. It was great. I continued to work part-time at the ER. And just because I want to keep my skills up. I want to be knowledgeable about the changes. And so I continued to work there. I worked at the high school. In 2015, I decided, I think I want to go ahead and get my master's. And I'll tell you honest truth. I got a big $5,000 raise by doing that because I worked in public education. So I thought, whoo, I'm going to spend X amount of money to make $5,000 more dollars. It'll take me 5 years to pay it off, but I'm going to do it. And so I did. I began the process of getting my bachelor's, and then I completed my master's in 2017, December of 2017. And I loved it. I was excited because at that point, what I went into was I actually got my master's in nursing education. And there were only a couple of schools online that were offering that specific master's. And to me, it made sense. I'm a nurse. I was a teacher. Why not be a nurse educator with a master's? And now, fortunately for all of the learners graduating or those that have graduated, there are just about any school that offers a master's in nursing offers a master's in nursing education. And so I'm glad I did that because it really did show me how to be an educator. Like, I've been a teacher for a long time, but it taught me how to become an educator. And so I did that. And I kind of realized I was I don't want to say wasting what I had learned, but kind of wasting what I had learned, because what I had really learned was more for higher education, post-secondary. And so I was able to go back and work at the college that I had graduated with my associates. And that was fantastic. I loved working there. The fact that I went there, I understood so many of the policies, so many of the procedures. I knew the angst and the complaints that they had about all the things, because they were the same things I complained about. And so, and sometimes learners, well, they were students there. Sometimes my students would complain. I go, no, no, no. I did the same thing. You'll be fine. You did. Oh, that's right. So they kind of knew coming to me was, and I loved what I did. Nightingale presented itself to me, and I love the fact that Nightingale meets the learners where they're at, not only through DFCs across the country, but it meets the learners where they're at because we have such a diverse population. We are reaching people to become nurses that never would have had the opportunity. I believe the number is we're at like 60% of our population is now what traditionally never would have even been able to get into college to become a nurse. 60% of our population. That's amazing that our learners are given that opportunity. And so that's kind of what put me here. I love teaching, and I love the fact that I can be a nurse and I can teach what I do, what I love, but I love the fact that I have learned how to become an educator along the way. But that's kind of me in a nutshell.
Thank you for that. Like, that's kind of, it's like good to know, one, that you said that, Nightingale touches that category of students who probably couldn't. Like me, I would never had gone back to school. I had heard about Nightingale years earlier at a different school, but just couldn't make it work. So now I am grateful for that chance, because I'm one of those who would never gone back. I would have just stayed as, I mean, I like being a CNA, but that kind of breaks my back after a while. Too many surgeries
Oh,
already on that. But so my next question is, as a, educator, as a teacher, how do you get your students to engage when we're at DFC? Like, how do you get them to their full potential so that they learn? I know the biggest complaint we get in Nightingale is the nursing homes.
oh,
How do
I
you,
know.
as a professor, how do you adapt over that?
That's my favorite. I almost love being sent to a long-term care, a SNF, the places I don't want to go, over a hospital, because the learning opportunities really present themselves so much more than learners ever realize. And I'm pretty sure I could say I'm like at a 98% learner satisfaction rate after being in a long-term care facility or a SNF, because we were able to find a lot of those opportunities for learning that people didn't realize were there. But one of the things that I do is I engage with my learners and I engage with the patients, just like I was a nurse on the floor, or just like I was a one of the nurses working at the facility. I do my very best to outstep my learners, because the thing is if I'm outstepping them, that means that I'm running circles around them and I'm doing just the things they're doing. And usually by the end of a DFC, we do like to compare watches. And every once in a while, I do have that learner that goes, "Where are you at?" And I go, "You got me." And that's one of the things that I love. I love the engagement. I have a box of things that I tend to bring with me for DFCs, for hands-on learning opportunities, things that I have acquired through the school, things that I have acquired from my job, things that even some of the local doctors have given me to help with those hands-on skills that may not present themselves while you're in a facility that doesn't have IVs, doesn't have maybe catheters or ports to access. But really, it's that engagement with the learners on the floor that, and I can't, to be honest, I don't want to say I'm excited and it's a fake excited. Sometimes I'm tired, but there's a difference there. But I really am excited when I see the connections that learners are able to make between that didactic and then between that clinical experience. And then we can grow with that, and we can learn together with that. I have learned so much from y'all in DFCs. I have so much respect for my learners, the things that they have taught me. Because you guys bring so much to the table as well. And I think that that's part of the reason that, I'm able to have those experiences because we're able to share some of those things together, or those aha moments where we both learn something at the same time. Like, I didn't know that. Did you know that? No, I didn't know that. Oh my gosh. I mean, I'm old. And so we won't talk about that. Okay, I'm 46, it's fine. But the thing is I can never stop learning. And I always learn something at a DFC, which is exciting to me because I work in a hospital, I still work in the ER. And the fact that I'm able to go into some of these facilities and learn right along with you guys is pretty exciting as well. Did I answer that question or did I just talk a lot?
Yeah, you answered. This kind of like makes me regret that I never got to have you as my DFC professor, because I loved all my DFC professors though. They did the same thing. So I was not one of those. I never got a hospital. I work in one, but you're right. I started my career off in long-term care and I forgot what learning opportunities there were. And I said, but my most recent DFC, we had a code blue. And I was the student that ran straight for the door trying to help until the rest of the team could get in there. And as soon as they took over, I was like, okay, I can leave. And I just watched from the door as they were. So those, yeah, there's learning opportunities where we can get them. My next question is, for those who want to do this, so like this is more of a personal one for me. What would you say, how long would you say to be a bedside nurse before we look into going into the master's program to do this education? Or is there any
So,
set thing? Like, I know someone said like 1 year, and I'm like, I don't know if I could be an effective teacher after just a year.
right. So that's kind of a loaded question. Professor Hall's on here and she probably understands that one. So when I graduated in nursing, it was a minimum of 2 years before you could start any master's program. Now that was in 2008. I don't think there was any there. If there were any master's nursing education programs, they were on ground. I don't know that there were that many. I know there were no online ones. I mean, we were barely using a computer then. That was MySpace world. Okay. And so that being said, it was a minimum of 2 years before you can even start a master's program. And those were for people that were going to be providers, not educators. And in order to educate, you have to know, but you have to understand. And one of the things I ask my learners is, I don't want you to know what you're doing. I want to know why you're doing it, because if you can't tell me the why, then you don't really understand. And if you don't know the why, you're not going to be able to explain it to your patient. And so I'll be honest, the why doesn't come at the same time for all of us. The why comes different times for us. And I would say, in my opinion, the best time for you to realize it's time for me to go on and move into to get my master's in nursing education is when you can fully understand and explain the whys to your patients. Because then at that point, you're going to continue to grow as a nurse. Don't get me wrong. It's not like you're stopped and you're done. I know the why, I'm out. But if you have a good grasp on those whys, you're going to be able to convey that to your learners. Everyone's different in that aspect because we all learn differently. We all work in different situations. Some of our jobs, and I don't mean this badly, but some of our jobs don't require as much why as they do the what's. Or sometimes we get so into what we're doing, we stop remembering why we're doing it. And so that would be my recommendation. Know why you're doing what you're doing, and then be able to explain that to a patient in a way that they can understand. And then, Mary, when you have that up at that moment, you're going to go, I'm ready. I'm ready to begin. Because the thing is it's going to take you some time to complete that master's in nursing education. So while you're doing that, you're going to continue working. You're going to continue building that bedside knowledge while you're building that academic knowledge.
That answers a lot. And that kind of answered the other question I was going to ask was, what are the qualities for a successful nurse educator? And you kind of nailed it in that one. So I know, like, now I'm just saying I don't want to do bedside because I'm burnt out. I worked through most of COVID, and that, that tore me down mentally, physically. So I'm like, I don't think I want to stay there. But I do acknowledge that I don't have enough and I haven't hit that why yet. So I know that's something I'm probably going to go look into for a little while. So thank you for that one.
You're
Try not to fall
welcome.
out of my chair. Um, because that would be very embarrassing considering this is recording. Yes, Professor Hall.
And one thing, just wanted to piggyback off of Professor Winstead. I couldn't have summed it up even better. I think once you decide to go this realm, is you have to realize we are continuous lifelong learners. We are learning all the time. Like Professor Winstead said, she's learning every day, learning stuff from DFCs, and I learn from you guys. But I think if you put up this mirror and say, "Oh, I know it all," this education is not for you. And you're constantly changing, just like, now we have next gen. So here, we are now, okay, let's find new methods to help assist with you all learning, because quite frankly, the way that I learned when I became a nurse is not sufficient for now. Granted, I can take some of those things, but we have to get down with learning new methodologies, even technology in itself. And how can we make sure that we get the materials to you all in a way that matters? And, my goal has always been, if I get that breakthrough and you can use that with a patient, I've done it. I feel good from, that aspect of things. So just realizing you never stop learning.
Thank you, Professor Hall. So my next two questions kind of they blur together. So, what challenges have you faced as a nurse educator, and what challenges do you think that brand new? We've just graduated the MSN program. What challenges are they going to be facing in their first year of nursing compared to when you first started? I guess is the best way to say it.
So challenges that I've had as an educator, I mean, that's a tough one. I mean, I don't like to wake up early. Um, and I'm a night shift nurse when I work at home. And so day shift is like the bane of my existence. I don't understand day shift nursing. It's like, what are you doing? Why are you, I would say the challenges that I had, probably the same thing that anyone would experience in any type of position. You deal with different types of personalities that sometimes it doesn't matter what you do, someone may not like you, or someone may not like your approach, or the look of your face. I mean, it's just but that's in any profession. I think the challenges that I've had haven't been any different than when I was a 20-year-old running a Subway, than when I was a 25-year-old working at the Walmart while I was going to college, than when I worked last week in the ER. I think that those types of challenges as an educator present themselves just like any other job. If you talk to an educator, they're gonna be like, "Oh, administration is the worst." Well, you talk to somebody that works at the Walmart, what are they gonna say? "Oh, management is the worst." So it's one of those things you just have to realize that you need to do the best you can do and be the best you can be for other people. Um, and at the end of the day, is that you're doing your best. And if there's that person that you just didn't G-haul with, it's fine. We're all gonna have that moment. The second question was what? About what?
What are some of the challenges you think that
Oh,
new nurse educators are going to face, especially now we're in the time of, now, like I know you mentioned when you had started, online school was not really a thing. So now that's all we see. So
yes.
what would you think is the biggest challenges new educators are going to face?
So there's a lot. There's a lot. It's not something and I'm not saying that to discourage you, But education and nursing are two totally different beasts. In nursing, it's either we need it 5 minutes ago or we need it now. Education doesn't move at the rate that we do in nursing. They like to, and this is not Nightingale, this is education as a whole, because I've worked at other schools. It's just, it moves at a different pace than what we're used to. So one of the frustrations that a lot of new nurse educators have is like, well, why isn't it already done? Well, we have processes, we have teams, we have this and we have that. There's so many things that you have to step back. Another thing is, I personally realized that I had some things that I need to clean up in my own skills, my own processes. And the reason I realized that is I was now teaching these skills and I was looking at them going, oh, wait, I'm not doing that. And the one thing that I always think of is I'm pretty good at IV starts. It's kind of my jam. And I work in the ER, which is a good thing to be good at the IVs, because if not, I probably don't need to be there. And I remember when I first became a nurse educator, I really needed to self-reflect on some of the things I was doing. As far as IV starts, I'd never thought about it. Now, it was probably taught to me at some point. I'm not going to take that away from my instructor. Her name is Mary Carrico, and she was pretty fantastic. I'm not going to take it away from her and say she didn't teach me this. But one of the things that I realized really quickly once I started teaching IV starts is, where was my finger going when I put it down there? Was I putting it on the insertion site? Because I was contaminating my patient if I was doing that. And I really needed to kind of not relearn, but make sure I was doing the things that I was expecting my students to do, and the things that I expect my learners to do now. And so sometimes I do get that pushback of, oh, you're just being picky. No, I do this in my own practice. Now, was I doing it all along? No, I wasn't. And so that was kind of hard, because it's hard to realize you've not been doing something properly. But that's one of the great things I think about being an educator, because I've been able to grow as well from seeing some of these things. Some of the other pushback that you may see as an educator is, I don't know why, and this is one of the reasons I love Nightingale, 100%. Depending on where you go to work, a lot of the instructors love to say this quote. Well, that's how we've always done it. And my response is, do you live in a cave? And they look at me and I go, well, we used to live in caves. And so if that's how we've always done it, I'm going to assume you live in a cave. A lot of nursing education programs don't change. And they don't change for that simple fact. That's how they've always done it. And what drew me to Nightingale is, that's not how they've always done it. And even if it is, we're going to constantly look at our processes and reevaluate what we're doing, why we're doing it, and change it. Because it's hard for me to ask students at a community college to know why they're doing things if I go into a meeting with the other instructors and they can't tell me why we're doing it that way, other than that's how we've always done it. And so I feel like that's probably one of the pushbacks that you'll see. And another struggle is, you will have those instructors that they don't mind change. Okay, they don't live in a cave, they're wonderful, but they've been doing it for 20 years and you're new. And sometimes you may be dismissed. I'll be completely honest. Your opinions, your anything that you bring to the table may be dismissed just because you don't have the experience. Not all schools are like that. Not everyone's like that, but you're always going to have those couple of people. And in my opinion, those are probably some of your biggest hurdles when you become a new educator. But if you think about it, it's not too different than nursing. You go into the hospital as a new nurse, and you have a new thing that's coming along, and your educators come down and they've shown you all the things, and then when the other nurse when they walk away, that nurse is like, I'm not gonna do it like that. This is how I've always done it. Or you're a new nurse. Why would they, if you come in and go, I think that patient might have pneumonia. You don't know. I mean, it's not dissimilar from that, which is why I think making that transition in education for nurses isn't that hard, because we've kind of got that thick skin already. Move it into education. But that's not a discouraging thing, because I encourage anybody that wants to go into nursing education to please do it. I'd like to retire someday.
Well, I can't wait to become a nurse educator. Like, it's not that I don't like the bedside. I just want to teach others pretty much what all of our professors have given me. I want to give that back later to the future generation. And like you said, to take away from this is how we used to do it. I was reading something that they said, oh, only nurses stick on bedside and it's doctors who do teaches. Like, no, not necessarily.
No.
And we can change, it kind of goes into my next question in a way. That is, nursing is changing every single day. What we did 20 years ago, we're not doing now. And that's the same thing in education. What started off 20 years ago is not going to be like that in 10 years. So that's why I love this kind of little field. It's always changing. So into that, actually, my next question is, as a nurse educator and professor, you can answer this one too. How do you see the field of nursing education changing in the next 5 to 10 years?
That's a good one. There are so many programs that are opening up and opportunities for learners to do online programs. I know it used to be, if you wanted to go from a PNVN to an RN, you had to literally quit your job and go to class 3 days a week, go to clinical 1 day a week. I mean, I guess you could work the nights and the weekends, but you're in a full-fledged RN program. It's so difficult to pull those 40 hours. I think that nursing education is moving in the direction of more like what Nightingale has been doing, is meeting the learners where they're at. Like, okay, I understand you want to be a nurse when you grow up, but you need to quit your job to do it. That's not feasible. We can't do that. And so they're starting to become more flexible with the way that they educate, because I'm going to tell you what, I have had learners with Nightingale that I would be so glad if they walked in and they were my nurse, because when we're at clinical and they have that DFC moment of, you go, yes, take that with you and keep learning that way. When you put out a quality product, other people start to see that. And I believe that's another reason why schools are starting to follow the model that what Nightingale has, in essence, started, because they see that we are putting out quality nurses. We're not just going, oh yeah, they did pretty good, but we have like a 2% pass rate, so those couple nurses are super awesome. No, they see what we put out there, and they want that. I was actually at a DFC in Toledo, Ohio, and one of the nurses that worked there was actively getting her BSN. And the reason she started at Nightingale was because she was so impressed with the learners that came in for their DFC, that she said, I want that. I want what they have. And so I really think that that's where I see it going, is opening it up for more people, more diverse populations, people that never would have had that opportunity to become nurses, whether it's a PNVN or an RN. Because in my mind, they're all a nurse. Professor Hall?
I totally have to agree with you. I actually started off in academia teaching LVN or PN learners, and I would hear this so much. Well, I am not a real nurse. I'm like, what? You and how they are look at, because when it comes down, to the basics, when we talk about basic anatomy and physiology, if we talk about biology and med surge, it is the same. It's the care that you're providing. Now, the legality aspect, yeah, but you're still a nurse. And so I think, and we've seen this, we have more LVN, LPN programs opening up. I have seen, I don't want to call them pop-up schools, but so many schools are opening because this is a thing I we are trying to get prepared for when we talk about that of our baby boomers, okay? They're living longer. Who's going to take care of them? Okay? And so we have to produce, and then historically, when you look back at nursing education, um you have people who've been in the profession and they kind of, they stay there to retirement, but we have a lot of people that don't want to go into the profession because there's like, oh, look at the money. And so that aspect, I think, will have to change because we have to get good people to want to teach our future nurses. And I think, guys, I hate to bring this in, but now we're talking about technology. So I'm wondering, how will AI fit into this whole thing? And I don't know, I'm not there yet, but how, how will it work? And you know, we we got through a pandemic. We thought we wouldn't do that. We're still dealing with the ramifications of it. And guys, things change literally every day. And even with education, and I think Nightingale was on the forefront. They didn't have to shut down. They found a way, to make it work. So I think we are setting a precedent. I think things will still change, but again, the way in which the traditional style of nursing, it will no longer suffice to make sure we are producing. Um, and obviously we look at the quantitative standpoint of it, but what is the yeah, we have the numbers, but is there the passion? Is it the critical thinking aspect, that comes out of it? Because yes, things aren't changing. We're new diseases every day, and how are we able to deal with those type things? And again, as educators, just making sure that you all are prepared, and to feed off of Professor Winstead, because of those changes are happening. Going back again, how are we learning too? We got to stay on top of it. I can't teach you outdated methodologies when you're doing something totally different. So yeah.
That just kind of reminded me of, I forgot what class it was. I did the paper on how we do hand hygiene 150 years ago. That was not even taught, and how mothers were dying. And it was, they learned the base process of, you have to wash your hands between patients. And then they saw the numbers go the other way. So that's how I look at nursing also, is yes, it doesn't work then, but we're going to advance it and advance it and advance it. So that's how I'm also going to look at education in the future, is what is working now for you guys probably won't be the same for me in 5 years when I do decide to make that bridge, or in 10 years. Like I said, I might not even find my why in 5 years. I think I'm just reeling on the burnout feeling of get away from bedside while I still have my sanity.
And
Not that I
literally
have that.
things change, consistently. And, you know, granted, I get it. I've been on the other side. I've been a learner, still learning. And, you kind of see things and you're just tunnel vision. Oh, well, this doesn't work. Why are they doing this? And the beauty here of Nightingale, we go back to the table. Well,
Mhm.
all right, we're doing this, but is it working? Or and it's finding out a different reason, and things are changing all the time. And I would like to think for the better, you know, just to make sure we can meet the needs of everyone. And I think about, I graduated in '08, and I would have never thought there would have been a school where
Yeah.
hey, I have a person in California and I'm here in North Carolina, and and we're meeting up at some point. Like, how in the world does this work? But it's working. So,
So,
And you know, that's the thing. You hit on that, Professor Hall. It I never would have thought the same thing. You know, I mean, I literally had to go to the hospital the day before my clinical, pull out the charts, and then hope they were there the next day, hope my patient didn't get discharged. And then after I was done, I had to go home, type up my paper, and then I had to have it back to the school in my professor's box, not inbox, not a computer inbox, but her box on her door in order for my paper to get graded, you know, and now it's like done and sent, you know. And so the thing is we are finding new technologies, new ways to do things that are better. And one thing I love about Nightingale, and I think it should be everywhere. When you find something that needs to be fixed, and remember this, Mary, when you go into any of your careers, anybody listening, one of the things that Nightingale wants us to do is, and not just the educators, but the learners as well, if you have a problem, they want to hear it, but they don't want to just hear the complaint. What would you do to fix that? How could you fix that? And that's one of the things that is very forward thinking for people, and especially in education, because a lot of the times it's just, this is what's wrong, you know, instead, what can we do to fix it? And so and I think that's part of where technology is taking us into a whole new realm of, I don't even know the AI thing. I can't wrap my head around it.
Professor Winstead, oh, you brought back memories of going the day before. I completely forgot about that, but you're right. You were
Yes.
in uniform. So I
In
would
you,
go to the
oh yes, you had to be in uniform, and we wore this. I hate when learners complain about y'all's uniforms. Don't get me started. Our uniform was a white button up top with a collar, and the buttons were the size of a quarter. The pants had like this seam that was sewn up the front. And then the jacket, I know you guys have seen the jackets we wear in DFCs. That's what we had to wear as learners. So this crusty jacket that you had to wear in the facility. And it's like, okay, make me just stand out any more than you possibly can. So bad. So
that reminds me of my CNA uniform for school. It was pure white. Who decided to torture anybody with a pure white uniform during patient care has a very special place in the underworld right now. But so and that you kind of touched on my one of my last two questions, and that is, what advice as an educator would you give? So let's say like I was you're training me to be your one of the new teachers. What advice would you hand off to me so I don't go home crying every single day?
that's a good question. You know, I've been able to precept new educators to Nightingale, and then at my previous job, I was able to precept new educators that came in. Take every day as an opportunity. Don't don't take the negative home with you. I mean, I know that's hard to say, but we learners are people too. And as a nurse, sometimes we forget what we had to do in nursing school. Sometimes we forget about all those steps that we had to do and all those things and all those papers that we were like, why am I even doing this? And so sometimes learners can take frustrations out on educators. I would say don't take it personally. I don't know that I've met any learners or students that truly were malicious against me in their heart, but at the moment it felt very malicious against me. But it wasn't. You guys, kudos to you guys for all the things that you do, because it's been a long time since I've done it. And I look at learners that are my age and older, and super kudos to you guys, because I know I struggled and I was in my mid-20s doing it. I can't imagine doing it at the age that some of my learners are. And so I kind of have to step back, and that was probably my biggest thing is don't take it personally. Because you guys really, you're here for a reason, you know, and we all get frustrated. And I know that that could probably be the biggest thing that I think could make someone go, why would I do this? Why am I doing this? It's no different than being a nurse, though. If you think about it, you may have, I mean, if you work in the ER like I do, you may have 99% of your patients that aren't really emergent, don't need to be there, have bad attitudes because they had to wait. I don't take that home with me. It's just part of the job. And so, nurse educator, it's the same thing. You know, you just you love your patients, you take care of them. You love your learners, you take care of them.
Before I go into my last one, if anyone who is here with us, if you have a question, you can ask it. If not, then I think my last one would be this, not more to the nurse educator, because now I'm taking advantage of, I got two Nightingale professors with us, is if there is one thing from the educator side you could tell us as students, and how am I going to word this? I had this in my head. This is what I get for taking a nap. What is the one thing that you would tell us as learners to kind of remember from you guys? You kind of nailed it. You guys are still human. You're still, regular
Grace.
people just like us. Like if you said, as students, we get angry. I know I have in the past. I've gotten angry at a teacher because why did I get this grade? I worked 6 hours on this assignment and you still docked me half my points. So as an educator, what could you tell us?
So it's ironic you should ask me that because it hurts me when I see work that someone's turned in that I can tell they put the work in on it. I'm not saying you get it and it's half filled in and you go, you didn't even try. I mean, I'm talking someone that used a lot of words and all the things, and then you look at it, but it's nothing. It because they didn't fulfill what was on the rubric. I don't write the rubric. Um, uh, Professor Hall didn't write the rubric unless she did. I don't think she did though. She said no. And so the thing is one of the things that I do my very best to do with my learners is give them grace. And I would say if they could just give us a little grace and understand, I don't love annihilating a paper. I don't love having it just tore all to pieces. It hurts me because I know that you guys are really doing your very hardest and your very best. So if they could just give us a little bit of grace and understand we're doing it for a reason. We're following the rules, really, but we're looking at the rubric because like that assignment you talked about, Mary, that you spent 6 hours on, after you went back and looked at it and maybe either had the conversation with your instructor or looked at the feedback, hopefully you were able to go, oh, okay. You know what? That was on me. I either didn't follow the rubric, I didn't understand the rubric, or I went rogue and, did my own thing. And so I would just say, if you guys could give us a little bit of grace, I have not met a nurse educator ever that was like, I'm out to get these students and these learners, ha, ha, ha. Never. Like, we got into education, the majority of us, because we actually like teaching. We actually like the learners. We love to see you guys grow and flourish. I don't know any of them that are out there to fail you. Like, that's not what we want at all. So that would just a little, not even a lot, just like that much grace.
Well, that was the last of my questions, and I didn't get any. No one has sent me anything, but so thank you very much, Professor, for joining us, taking time out of your busy day, and just kind of explaining, the back end of nursing education. And I hope that when we post the video to share, that people can, see that there's more. There's more to just nursing. Nursing education is a good specialty to also look at in the future. So thank you once again.
Thank you so much.
Thank you again,
And
Professor. We appreciate
I
it.
think that's everything. So I will end our meeting. Thank you so much. And for anybody watching the recording, you guys can message Professor Winston if any questions pop up. Thank you.
Take care.
Bye.
Thanks.